All right. Moving on to a more medical topic. There was a recent article talking about some of the biggest medical breakthroughs of 2023. You like my picture?
Yeah, it's AI, I'm guessing.
What? No, I drew that. Yeah, it's an AI pic. So I was actually pretty interested in this because it's very amazing how fast the speed of medicine works. I mean, now I've been in medicine so long that really a lot of time has transpired since I started, and I've seen some pretty amazing advances in things. Like the biggest one that pops in my mind is that, back when I was younger, one of the worst things that I feared was getting hepatitis C from an exposure of blood, because I had this bad experience when I was a surgery intern where there was another surgeon that came in with hepatitis C and ended up dying. And we did a liver transplant, actually 2 on him, and then he ended up dying. And I was like, geez, man, I definitely don't want to get hepatitis C. And so that's something that in the back of my mind, because when you're a surgeon, you're exposed to blood and needles, and and needle sticks happen. I stick myself probably once a year.
Yeah.
Because I just throw so many sutures when I'm doing these big cases.
Yeah. And
it happens, and fortunately, most of the time all the times I've stuck myself, it's been with a solid needle. You don't want to get stuck with a hypodermic needle. That's the bad one. Okay. So like nurses are more at risk for that because they're doing blood draws to get contaminated blood. I'm using needles for sewing, so they're solid. They're less likely to transmit. But anyway, I digress. They ended up coming up with a cure for hepatitis C, which was unbelievable. I was like, oh my gosh, that's crazy. It's like coming up with a cure for cancer. Not really, but something that was really a big problem that they found a cure for. So I was very interested in this article, and some of these things are a little bit esoteric, but I thought it'd be just interesting to know what are the big medical breakthroughs for 2023. So we're going to discuss. So have you guys heard of RSV?
Yes.
I know you have because you have kids. Travis, RSV, heard of that one?
Yeah, I have.
Yeah, respiratory syncytial virus. So most people think that is a disease of kids, or I kind of historically have thought that you always worry about your kids getting RSV. But actually there is a very high number of older adults, so over 65, that get RSV every year. And I didn't know this, it actually hospitalizes 60 to 120,000 elderly people every year.
Oh, kind of like pneumonia.
Yeah, it's actually the most common cause of lower respiratory tract infection. It's a viral pneumonia. I guess we'd call it walking. I've always called viral pneumonia walking pneumonia as opposed to bacterial, which does tend to be a little bit more aggressive. And there's 6,000 to 10,000 deaths a year from RSV in older patients. So they actually have come out with a vaccine for RSV, which is new. That's not something that I think.
Is it for adults?
Yes, I think it's targeted for older adults.
Oh, okay. Kind of like the shingles vaccine.
I'm sorry?
Kind of like when older people get the shingles vaccine?
Yeah, something like that, yes. Yeah. Things that affect older adults more. So I don't think they're trying to give it to kids, or that wasn't mentioned in the article, but yeah, pretty wild. RSV vaccine, something that's totally new. I don't know about the efficacy yet because it is kind of brand new, but that's something that's out there. If at least you can ask your doctor about if you or yourself or have family that are older. So next, this one's pretty interesting. They've come out with a new gene therapy for sickle cell disease.
Oh.
So sickle cell disease, for those that aren't familiar, is a genetic condition where your red blood cells go from a spherical to a more sickle or knife type shape. And that's not good. It tends to cause the blood vessels to get caught up or cause damage in the organs, and can cause a whole host of problems like stroke and kidney disease, blood clots in bad places. It's very common in the African American community. Charles, you're familiar with sickle cell disease?
Yeah, I am.
So it affects 1 in 365 African Americans, which is a much higher number than the general population. It's a genetic thing.
Yeah.
So they have a new gene therapy for it, which is apparently very effective. It's something new that hasn't been out before, and there are a lot of people that suffer with sickle cell in the United States, and so anything that could potentially treat those patients, I think, is pretty interesting.
Absolutely.
Okay, here's an interesting one, Sarah. I want your thoughts on this, and I meant to ask my wife if she's. Cindy, if you're watching, let me know what you think about this next one. It's over-the-counter birth control pills. So historically, birth control has always been
prescribed
by prescription. And the reason for that is most birth controls, and my wife's probably going to yell at me because I've messed this up. Most of them, I think, are estrogen progestin combo. And I think the estrogen is what makes them a little bit more, I don't want to say dangerous, but more prone to have side effects. And so it's important that you talk to a doctor to go over, do you have risk factors that might aggravate these risk, do you have risk factors that will aggravate the risk factors of the birth control pills? And so I think that's the main, but I've always heard, that there has been this push to do it over the counter just to increase accessibility, which, I think is a good thing. So there's a new progestin-only mini pill. They call them mini pills because they only have progestin, that is now FDA approved for being over the counter. You can literally go pick it up at a pharmacy. Did you know about this? Is this like a thing that women know about?
I used to take it was like Lolo-estrogen.
Okay.
Lolo-estrin is what it was called, but it was because it was low estrogen.
Right.
Because I have naturally high blood pressure, and whenever I was on birth control, if I take regular birth control, it gives me like even
worse.
More. Yeah.
Yeah, you have to be careful. I mean, there are some pretty severe side effects from some of those.
But now I don't take any of it because I think it's all not very great for your hormones in general.
Was that one that you took over the counter or prescription?
It was prescribed, but that was before.
Yeah.
I mean, I got that prescribed to me after I had Avery.
Gotcha. So, I mean, to my knowledge, this is the only one that's over the counter. I've been hearing that they were going to make birth control over the counter forever, and then there was some pushback from the doctors because, as you just said, there are risk factors associated with that. We all know that. And if for someone like yourself who has, a baseline blood pressure that's high, I mean, you definitely need to at least have a doctor check you out before you get it. But the mini pills, I think, are a little less likely to give you those issues.
Yeah.
So I think
aren't they coming out with like a male form of birth control or something?
I've heard that that's in the works, but I haven't seen it yet.
And like the main reason why they don't think it'll work is because they just don't think men will be
Men won't take it. They're not reliable.
They won't be able to take a pill every day.
Yeah, they'll forget.
Real quick, Robert Dreschel said, I'm not sure I trust OTC birth control pills. I'm not a doctor, but I play one on TV.
Okay, Robert. I appreciate that, buddy. I think that they're pretty effective. I don't think they would release it if it didn't work pretty well. Some of those, the oral contraceptives are 99% plus effective.
Yeah.
And I think that probably some of the ones that fail, maybe just to how you take it if you miss a pill or something.
Yeah, you're supposed to take it at the exact same time every day.
So also for women, the next medical breakthrough, which I found very interesting, is they found a potential cause for morning sickness. So morning sickness in pregnancy is extremely common. 80% of women get it. It can be very severe to the point that it can almost keep you bedbound. So they found a hormone called GDF15, which is produced by the fetus. And this hormone is what's been linked to causing morning sickness, because when that level of that particular hormone, GDF15, gets high in the mom's bloodstream, then they have morning sickness.
I never had it.
You never had it? I was trying to remember if my wife had it. I don't think she had it bad. To my remembrance.
My sisters did.
Did they?
My oldest sister, for sure. It wasn't even like morning sickness. It was just like she would just get nauseous from anything.
And so what the article was also went into a little bit more detail, saying that some people are more sensitive to this particular hormone. So it's not just, is the fetus kicking out a lot of this hormone, but how sensitive are you to it?
Yeah.
That determine morning sickness. But the important thing is once you kind of find a cause for a problem, then it's a lot easier to make a cure.
Yeah.
Yeah, so they don't have a cure for it yet, but now that they know exactly what's causing it, that might be the next thing. Okay, this is another good one. This one's also going back to older adults. The first fully approved drug for Alzheimer's was released. Now,
I saw that.
I thought Aricept had been out for a while, but what it was saying is that the previous drugs had ended up failing clinical trials. So I probably should have actually looked at that, because I remember Aricept has been out a while. I don't know, have you heard of that one, Aricept? It's just a drug that a lot of people that have Alzheimer's take. But since I don't really treat Alzheimer's, I wasn't really clear on how well it worked. I didn't think it was a miracle cure drug from just my basic knowledge of it.
When did that drug that you're talking about come out?
It's been a long time, like 10 or 15 years at least.
Oh.
Yeah.
It runs in my family, so.
Alzheimer's does. So there's a new drug out called Leqembi, Leqembi, and it has been shown in clinical trials to slow cognitive decline associated with Alzheimer's, and it does it by targeting the amyloid beta plaque. So Alzheimer's disease is a result of this plaque buildup in the brain, which starts to affect how the circuits run and how the messages are transferred from different areas of your brain, which affects cognition. And this drug attacks those plaques that are the cause of Alzheimer's. And it apparently is fairly effective. It didn't give any hard numbers, but they were very positive on it. And it's just received FDA approval, and so I assume that we'll be hearing of people.
Yeah, so do you get it prescribed if you've been diagnosed, or is it
Yes.
more of a preventative?
No, I think it's not a preventative. Well, I don't know. Maybe that's a good question.
I know it's a hereditary.
It is.
Most of the time,
Yeah.
and so it's I wonder if
you take it preemptively.
Yeah.
That's a good question. I'll ask some of my medical doctor friends if they know the answer to that. I mean, I could probably do a Google search, but probably better to ask a doctor.
Yeah.
I don't really treat Alzheimer's being a surgeon, especially a plastic surgeon. I have basic knowledge of it. I remember the amyloid beta plaques as the cause. But yeah, this new drug, Leqembi, Leqembi, first fully approved drug by the FDA. Probably, I bet Aricept was maybe partially approved, or it had some green light, but they were like, it may or may not work.
To add to that, I saw an article about how diabetes is linked to dementia and Alzheimer's.
Diabetes linked to so much.
Yeah, because they've discovered that it's like an insulin situation as well. So I thought that was interesting because that also runs in my family. So I'm like,
make sure you go to the doctor regularly.
Yeah.
Good for you.
I don't have diabetes, but.
It's good to just keep on top of things just to make sure that nothing's popping up.
Yeah.
Okay, as a surgeon, the next one is super interesting to me. So one of the worst cancers out there that you can get, absolute worst, is pancreatic cancer.
Yes.
The 5-year survival rate. So 5-year survival rate is a very common gauge of how dangerous a cancer is, and basically it's a number that says, okay, 5 years after diagnosis, what % of patients are still going to be alive? And so for something like stage 1 breast cancer, it's 98%, which is really high, right? 98% of people are still alive. As the stages get worse, then that number starts to drop. But the overall 5-year mortality rate, or 5-year survival rate, the 5-year survival rate for pancreatic cancer is 10%. It's terrible. It means 90% of people who get a pancreatic cancer diagnosis will be dead within 5 years.
Yeah.
It's crazy high. I remember doing a lot of endocrine surgery when I was in general surgery and surgical oncology, and I didn't like pancreatic cancer because I just felt so bad for the patients. It was just very kind of sudden. It's a very ominous cancer. It pops up, and usually by the time it's diagnosed, it's really advanced.
Yeah, that's what I was going to say.
Yeah.
By the time you know that it's there,
it's really bad.
Too late.
And the pancreas is right there by some super critical structures. So once it starts spreading, I mean, it's problematic very, very quickly. So there's actually a new vaccine for pancreatic cancer, which is kind of the new thing where they're getting vaccines to not only prevent but treat cancer. So this vaccine triggers T cells to actually attack the cancer cells. Now, the thing about this vaccine is it didn't work for everyone. So in the trial, I want to say about half the people had a really, really good response. But what was amazing is in the people that got that big T cell response, it actually cleared the cancer to where they couldn't detect it a year or two later.
Oh.
That is unbelievable. I mean, a lot of people.
So it saved people?
Yes, yeah.
Nice.
That's what they're saying. Now, the trial is pretty small, so it's not this really big landmark trial, but the initial data was very, very encouraging to me. And to be fair, pancreatic cancer is not super common. I mean, it's not like breast cancer, lung cancer, colon cancer, where the numbers are really high.
Yeah.
But like I said, what made it really, really bad is just it's very, very aggressive. It's very common that it's pretty far advanced when it's diagnosed, and it's just, there's not great treatments for it. But this is very encouraging. So yeah, I found that interesting. Finally, coming back to the very beginning of the segment, AI.
Okay.
AI programs boosted cancer detection for breast cancer. So there was this program developed by the Brits. It had a name like Lucy or Mia, I can't remember now. had a name, and it was a AI program that looked at screening breast radiographs.
Okay.
And compared to humans, it picked up 13% more early breast cancers than the radiologist did. Our jobs are getting replaced already.
Oh my gosh.
It's going to happen to everyone. AI is going to replace us. So, I mean, that is interesting in that, AI is being used to, I guess, augment human detection. I don't think AI will ever replace, human, like a radiologist. I don't think that's going to happen, but I bet it'll be like a safeguard. The human will read it, then the AI reads it, and then you make sure that they coincide.
Yeah, for anything involving AI, I feel like you have to go back because AI will just make stuff up.
Yeah, I have seen that before. It's fine. AI occasionally will do that, and I've actually
if you ask it to write a book report about you. If it needs something to add something, it'll be like,
blanks.
Did you know he was an astronaut? Or it'll just put something in there. And
I've had to do that before. I've actually had AI make some pretty silly mistakes, and if you correct it, it'll be kind of embarrassed. It's like, oh, I'm so sorry, you're right. So you do have to check AI. I mean, I'm a big fan of it, as you guys know. I use it all the time. In fact, I used it for the segment we're doing. I mean, not for the body of it, but for the opening photo.
Yeah.
You do got to kind of keep an eye on it.
Yeah.
It has a tendency to go rogue sometimes.
Yeah. Speaking of that, did you see I don't know if it was from today or yesterday, but President Putin said that he has a vaccine for cancer.
Oh, he does? That's like a real thing, or?
Yeah, it was I saw a post about it.
Really?
Yeah.
I did not see that. I will absolutely go look that up.
Doesn't he say stuff like that all the time? Like he's like, we got this, and then you're like, okay, and then it never. And
it never shows.
Yeah.
I don't know. Maybe I don't know a whole lot about Putin. I did watch that interview that he did with Tucker Carlson.
Yeah.
It was very long and a lot of history. I actually watched the whole thing just because I was just interested to see.
I watched the recap of him trying to figure out what exactly happened. He was just like, I don't know that he ever actually answered one of my questions.
Tucker Carlson asked a question, and it was like a 40-minute answer.
Yeah.
Going through the history of Russia.
Yeah.
But I'll have to look up the Putin cancer vaccine.
Yeah, I think I saw it on BBC, their little Instagram thing.
All right, well, I'll take a look and see if that's a real thing. Yeah. So, all right, you guys, that's all the time we have today. Thank you guys so much for watching. Please hit that like and subscribe button. Leave us a comment. Can't wait to see you next week here on Nip Talk.